We had quite big problems with his ears, for example. Yeah, they were blocked. It was just wax in there. But doctors were very nice, and we did get to the Brighton's hospital, and they put him a little bit under anesthesia, and they just take it out in 15 minutes. And they said everything's fine, and the experience was lovely. The doctors were really nice, yeah.
They were both born here, and I have to say, it was the most amazing experience here, to be honest. Excellent service, excellent help. It was really good.
I think I would like to thank diabetes team in St. Richard's Hospital. My daughter, who is 10, was diagnosed with diabetes 3 years ago, and the experience we've had is all good. It's wonderful how the nurses, Emily, Jane and Dr. Romarino have been looking after my daughter, and I'm absolutely overwhelmed with care we can receive. So I have absolutely no complaints whatsoever.
I think overall it's really good because you know that it's there and you can use it.
I'm happy because everybody can go to the surgery, but I'm not happy with that. All of this care is very slow and system is very slow.
The first point of contact is GP, which for children is excellent. For adults, it's a little bit more difficult.
Funny enough, most of our workers, they are not registered with the GP. Most of them didn't realize like they must do, but of course, probably they didn't because maybe they were worried like they should pay for. They may not realize that NHS services are free of charge. When you need to register, you need to show the proof of your tenancy agreement. Most of the foreign people, they sharing accommodation to make the things more efficient for them, to split the cost, you see.
It's called before 10 o'clock, I think. So to get the appointment, it's the same day. And we, most every time when we need it, we get it. So yeah, it's good.
When I book an appointment at the GP, sometimes I have to wait for hours, even when I go with a child.
If it's not emergency, it's really difficult to get an appointment and you have to wait for a long time. And the afternoon and evening appointments are gone within like minutes.
I'm waiting for my appointment for more than 1 month. They've done some investigation for me 3 months ago. I'm still waiting for results.
If I am lucky, I will go quick. If I am not lucky, I will be stay 5 hours to wait.
Usually when I call in the morning, if it's an emergency, they give you an appointment that day. If it's not an emergency, you wait for a couple of days, but I find it really good.
We go to the GP first, and they just send a letter, and everything's happened by itself.
Getting through to specialists, like say dermatologists, is quite difficult as well. Just not all GPs are kind of eager to, refer you.
And long story with the questions by phone, a lot of questions really. I think really this service must just doing this quicker. Just come into address and check everything,
People get a muddle between Tuesdays and Thursdays and dates and times and everything.
The only problem was that when we had to phone the hospital and call an ambulance, there are a lot of questions to go through. What we are used to is you ring and you say, right, the person is having this kind of problem, they look like this, so you give the story. You don't necessarily answer the questions. You have to actually know that you have to do that and you have to be prepared. Your language doesn't allow you to answer quickly. Maybe having some kind of booklet or somewhere on the website, or maybe those set of questions could be translated and put out in a GP surgery, my idea.
I'm really happy with my GP surgery, not so happy with A&E. Wait time was absolutely ridiculous. We saw about 5-6 nurses and they were asking us the same questions over and over again, and we only saw one actual doctor. A couple of times that I've been to the dentist, I've been really disappointed because there's been things I've wanted to talk to them about, and they literally see you for 2 minutes, and you still have to pay. I know we pay taxes, but you still have to pay for that appointment, and it's literally 2 minutes, and it's a conveyor belt of people. So I'm actually going on holiday in Bulgaria, and I always go to a dentist there because not only it's cheaper, but they actually listen to you and your concerns because I have a bit of a gap between two teeth, and I just wanted one of the teeth rebuilt, and they wouldn't do it because to them it's cosmetic, even though to me it's not, because there's always food there dislodged, and it's just not very nice.
Some of my friends using private Polish clinics, the one in Atlantic, I believe in Southampton, or some in London, if they've got a bit more serious problems when they need a bit more, I don't want to say experience, it's probably more with a language as well, because of course if they are Polish they cannot speak really English, they find attractive Polish clinics because of course they talk in their language. From my friends, and I know lots of people around, yeah, some of them they went to see a doctor, and again they've been given paracetamol and the symptoms didn't finish after like a week. Then they went to the Polish clinic and the doctor said like, oh, the person should have the antibiotics because it's some kind of the infection.
I'm working in the hospital as well, and I can say we've got lots of equipment, lots of stuff there, but we haven't got enough specialists for proper care.
With having only 2 scans when you're pregnant, I mean, I had a lot of complications with my second child, and I think if I had more scans towards the end of my pregnancy, things would have been prevented, and it is what it is.
We've got lots of Polish food shops. If the kind of the leaflets could be distributed in their Polish language, mention like, oh yeah, it's really, you know, it's really important for you when you will arrive, when you will apply for national insurance number, to just be in touch, and it's nothing to be really worried about.